Hi, everyone. So, this is the capstone that we have for our medical virtual assistant. So, basically, this is the end to end patient journey simulation from your first contact up until the last. So, what we will be having, not really the last, but towards the appointment of the patient. So, we are part of a group 9, and the clinic that we have is for physical therapy clinic. So this presentation is based on a simulated patient encounter and is intended for educational and training purposes only. All patient information presented here is fictitious and does not represent any real individual. Okay, so you do have call right with your patient. So probably this is telehealth, or probably this is through the email that you have with your client, or they've submitted an application or something like that. So basically, you need some items for the initial. And first, of course, is the name. So that is the legal name, first name, last name, the date of birth, their email address, or and their phone number as well as their address. Also, you have to make sure that the insurance is there, providing the member ID and all the information necessary for the insurance. So, of course, as a medical virtual assistant, you have to give them the schedule. So, what we have here is basically the available schedule that we've presented with our patient. So, we are going to use simple practice. So, this is an EHR that you can access freely. It has a 30-day free. So you can access it. Just make sure that you are using a VPN so that you can go to their website or make your account for that. So as you can see in the PowerPoint, we do have different areas where we can add the client since we have a new client or a new patient. And this is basically their initial physical therapy examination or evaluation. So these are the highlighted items that we can use, the plus sign on top, or when you click the calendar, you can create a client for your patient, of course. And even when you click clients tab on the left side of the website application, you can basically plus create or create the client. So once you are there, you are going to have the demographics, or you will be routed to a pop-up demographic screens. So just input or make sure that you write there the necessary information for your client. So name, date of birth, if they are billed through insurance or anything whatsoever, the status, the email address, as well as their phone number. Next is for their appointment schedule. So once your patient is already inputted in the application or in the EHR that you have, of course, you need to schedule an appointment for you to clearly make sure that the patient is there. So you can basically click the new appointment. You can also add the plus sign and do the schedule appointment. And if you finished with the profile of your patient, you can basically schedule more and choose the availability of your physical therapy or of your doctor. So this is basically what it looks like. The appointment is 12/16/2025, and you have there all the information for the appointment on the 16th. Okay, so once you are done with the profile, you need to make sure that you send or submit the intake form to the patient. So you can definitely use simple practice for that one. So you have to make sure that before or prior to the appointment, all the intake forms are completed. And this is necessary for the doctor or the therapist that you have to do the examination. So once we're done, now we go to the insurance verification. So since the simple practice that we have, the account that we have, we could not access the insurance verification. So if you do have like a legal account for that one, you can use the EHR because they do have an insurance verification for that. If you cannot or you don't have anything with regards to insurance verification with your EHR, let's just say you don't have, you can always use Civility or other platform for you to check or verify the insurance. You can definitely call the insurance that the patient has if it's much accessible and you can do it as soon as possible. Just make sure that you have written or inputted the reference number and also ask specific questions or the questions necessary to make sure that you are well taken care of. Also, you have to make sure that prior authorization or authorization is necessary with regards to probably visits or outpatient or inpatient, and even for their prescriptions or physician prescriptions and referral. Okay, so once we are done with the insurance and everything, so this is basically the 16th already. So you do have progress notes or basically the SOAP note. This is really necessary because if you don't have this, you will not be billed with regards to the billing. Because, of course, in every visit, in every services that the patient or the clinic provided the patient receive, you need to be billed for that one. So SOAP, this is just an example, a simulated example of the SOAP that we can have for our patient. You can also have this. So this is what Simple Practice have with regards to their SOAP. So as you can see, it's detailed already. So you can just input everything. You can also have like, because it really depends on the clinic. If they do have medical scribes, so that's the live scribing, or there's a recording of the visit, and probably the doctor will or the clinic will tell you that okay, we do have a medical transcription and they will be the one who will be making this or that. So they do have this. So you need to make sure that these are in the file, because it might be that one of your roles will be for billing and you don't have supporting documents with regards to the diagnosis and how will the clinic be billed by their insurance. So next we have is the medication of the patient. So we are using Cover My Med. So this is prior authorization for the prescriptions that the patient received. Next we have is for the claim creation and the submission. This is basically again what I've said with regards to the medical billing or for the clinics to receive payment through the insurance of the patient. So again, earlier, like I said, the account that we have, this is just a simulated information or the simulated simple practice account. So basically, if you will see, when we submitted, we could not submit it because of the lacking information. So these are just the additional or the things that you have to make sure that it will not happen to you, so that there won't be any denials or anything whatsoever. So missing or incorrect diagnosis code, time-based code billed incorrectly. So this is with regards to the number of hours that you've inputted in the claim with regards to the given or the allotted that they have. Next is the authorization required, but it was not entered or you were not able to ask for it. And the place of service is incorrect. So probably the clinic, it was not updated or anything like that, and so on. Next, which is the last items that we are going to think about, is the patient communication. So it's very important that you've provided, aside from providing care, you're also providing right and necessary communication with regards to your patient, because if they do have some questions with regards to the things that they need to fill, or even with regards to the insurance or why were they billed and so on and so forth, as the virtual assistant or the person who will be using or doing administrative tasks, these are also one of the items that you have to make sure that you are providing to your clients, sorry, to your customers or patient. So these are just examples that we have that we can use. You also have to make sure that it's HIPAA compliant. So as much as possible, don't share any information with regards to the results of the lab or anything like that, because you or the clinic might be, in great danger or might be flagged with regards to that one. So if ever there are some informations that you are not so sure, you can always ask your clinic or you can always ask the clinician or the therapist with regards to the things that is not needed to be shared or informed. So yes, I think that is all for my end. Thank you so much, and I hope this was helpful.